we take in enough fish oil, antinol, green lip mussel, krill oil, then our membranes, instead of containing arachidonic acid, contain eicosapentaenoic acid, which is going to break down through the LOX system and the COX system, and we'll have less inflammation here, and we'll have less inflammation up here. Now, this is an interesting thing to look at, because all of the drugs that we use and our fish oils, they all work from here down, but there's some herbals that work in the LOX system. And so we will talk about those. There we go. Okay, here, this is just my quick nod to fish oil. That's the dose I use when I use it, 100 mg per kg, adding the EPA and DHA together for dogs. Cats, you need less. Now, the interesting thing is the studies were all done with fortified diets. And although I do recommend a lot of fish oil, sometimes it's hard for the patients to get to that dose. Some of them are going to get diarrhea. So that can be a little bit of an issue. So we'll talk no more really about fish oil, but we're going to talk about this guy. And this is a green lip mussel, Perna caniculus. And these are native to New Zealand, and they contain some very, very interesting things. They do contain omega-3 fatty acids, the EPA, DHA, and they contain this cool stuff called ETA. And they also have some chondroitin sulfate, and there's some other 90 amino acids and some things that we really don't know how they work and what they do that are in this stuff. But the important thing is that if you're using it, it needs to be either freeze-dried or you need an extract. So what does the research say about green lip mussel? Well, 3 out of 4 papers in this review were effective. The interesting thing is that the one that was about diet fortified with it wasn't, and maybe it was dosed too low or not in the right form, because it's possible that the mussel extract was not treated properly in the diet because of the extrusion, possibly. The interesting thing is our extract PCSO-524, which is an extract of green lip mussel, seems to be very much more effective. And pretty new paper from the British Medical Vet Research Journal shows that if you combine this green lip mussel extract and an NSAID, it's going to be more effective at alleviating inflammation and improving weight bearing than when you use either alone. And there's a few references there that you can look up for other interesting things. So what is this PCSO-524 green lip mussel extract? So it's a lipid extract from our green lip mussels. There's a patented process that employs no heat, and that's important. I think that's probably why that last diet one failed, because you need, if you have heat and chemicals, you can decrease the potency of the extract. So they want to keep it at the highest level. And it's a lot more complex than just your EPA and DHA. There's 90 different fatty acids in it, including octadecatetratetanoic acid. Well, can't hardly say that one. And ETA, we'll just leave it at that. So these fatty acids are going to work together, and they create a very potent anti-inflammatory response. So there was an interesting paper of this particular thing versus fish oil. And really, what they found, that there was no statistical significance improvement in any of the parameters of the fish oil group after 12 weeks. But they did find that there was, after a couple of weeks with the PCSO, and after 4 weeks, it was very much improved. Now, I went back and I looked at it, and I have to say that I do think that the fish oil was a little underpowered in this study. But the results still for the PCSO were very, very, very good. And there was a human trial that showed a very similar thing. So how do I use this? I'm going to use this for DJD pain in dogs and cats. And here's something really cool that I have learned to do with it. I use Antinol, because this is Antinol, and I use it for bladder pain for cats that have feline interstitial cystitis. It's a great, great thing, and it's very easy to get your kitty cats to take this. If they won't take the little tiny pill, that is the Antinol pill, you can, puncture it and drop it out right away. And I'd asked them about a liquid form, and they said, unfortunately, that the gel cap is sort of integral to this to maintain the quality of the extract. So that's interesting. I've also used it for feline asthma. So you can think about using this for anytime you have pain in a kitty cat and in a dog. I haven't used it for dogs with allergies, but certainly cats. And so that makes it a great thing. Interestingly enough, I was teaching over in Taiwan 2 years ago, and Antinol is what they reach for before they reach for NSAIDs. So I think that that's quite an amazing thing to think about. Now, undenatured collagen, remember that study? Green lip mussel extract, which is our PCSO, which is Antinol, was working, and so was undenatured collagen. So undenatured collagen works a little bit differently. This particular type of collagen is actually released when the joints are broken down. And so how undenatured collagen works orally, and this stuff's derived from chicken sternum, and what you are doing is something called oral tolerance. So that's almost like vaccinating your patient for joint disease, really, an oral vaccine, because you're creating oral tolerance so that the immune system sees the undenatured collagen type 2 and then doesn't see it as foreign. So it decreases the immune response to the joint. And I have to say, personally, I took undenatured collagen type 2 when I ruptured my meniscus. I was very happy with the results, and I wasn't happy with my glucosamine chondroitin results. So anyway, so this is one of the Now Nutrition ones. The dog one is really Flexidin Advanced, but Gupta did a really good study on this. He had 4 different groups, and it was a blinded study. It was in our species. So placebo, they used glucosamine plus chondroitin. They used glucosamine, chondroitin, and UC2, and then UC2 alone. So overall, what did they find? Well, decreased pain on manipulation in the UC2 alone and all 3 of the treatment groups. So in this one, there was some effect from glucosamine, chondroitin, and it was safe. There was no renal or liver panel problems. But what they found was that the quickest ones were in the UC2 alone group, so 90 days versus 150. And UC2 is more effective alone than when it's combined with glucosamine chondroitin. So if you're going to use UC2, however you're going to use it, you're probably best to just ditch your glucosamine chondroitin. You can use it along with your Antinol. I don't see any problem with that. Just don't use it with glucosamine chondroitin. The interesting thing is this new product, Flexidin Advanced, they've added boswellia, and we'll talk a little bit about boswellia, I think, if we get there. I have to speak maybe faster. I also get asked about Elk Velvet, and it does work. And there have been studies designed. This one was from back in 2004. Of course, it was published in the Canadian Vet Journal. Anyway, it was a very good study, and it was a forest plate study, and it did show that these animals do improve with Elk Velvet. So if someone comes in and they want to give their animal Elk Velvet, well, then I think that that's probably okay. It's a little bit of a thought. So how do you get the Elk Velvet off of the antlers? I don't really think that I like to think about that. Many people might think about it. So we've talked about regular nutraceuticals. Now we're going to talk about the botanicals, because it's really exciting to talk about herbs and botanicals, and people are interested in it. So how about our avocado and soy unsaponifiables? ASUs tend to be quite effective. If you have a look at our pictures there, this was a surgical model where they went in and ruptured a cruciate in a dog, and then they gave some of them avocado soy unsaponifiables, and they gave others a placebo. And here we see the ones that had the placebo, you can see what the cartilage looks like on the right side there where the femoral condyles are, whereas the ones that were given ASU, the cartilage is much better. So there were fewer osteophytes, thicker cartilage, fewer lesions. So it does appear that this avocado soy unsaponifiables do work. And obviously this is something that's not actually in the avocado leaf that can be toxic, or in the avocado itself. It's actually an unsaponifiable and is fine for our patients. So that is found in this product, and you probably have used this, Dosage Advanced, and it does have chondroitin sulfate in it, but I think it works for a couple of reasons. It has avocado, soy, and saponifiables, and they've added boswellia and curcumin, and I think those are probably the most active ingredients, and I've had success with that product. So Herbal Basics, what will happen? Your client is going to want to use herbs on their pet. So they might bring in a capsule and something that they're getting off the shelf in a pharmacy, but they could bring in a tincture, they could bring in a powder, they could bring in a tea, they might bring in a plant. So how do you know, and what do you do with this sort of stuff? Sometimes that's a little bit difficult. I can say, if you do have a client who brings in an alcohol tincture, you need to be concerned about that. Don't have them give that straight to your patient. You can make it safe if you take whatever the amount of the herb is. Let's say it's a quarter of a teaspoon you're supposed to give this dog. So mix that with at least a quarter of a teaspoon, if not more, of hot water, and let it sit on the counter for 10 minutes. It will evaporate the alcohol off, and then what's left will be safe. I can't guarantee that the hot water is not going to affect the herb, but that's the way to make it safe. So this comes from my friend Susan Wynn, as to what are the dosage equivalents given the pet's weight for things like teas, dried herbs, and tinctures. And as you can see, there's a difference. If you're using a tea and you're 20 to 50 pounds, you're going to use a quarter to a half a cup. Whereas if it's dried herb, a half to 1 teaspoon, tincture, 5 to 10 drops. So a lot of times people figure that less is better. So they might want to use the concentrates and the tinctures. So we're going to talk about a few common Western herbals for pain that your clients are going to be talking about and going to want to know, do you know anything about this, doctor? Can I use this particular supplement? This has this in it. Is it any good? Well, boswellia is one of the ones that comes up with good research. It has been used for many years, and it is an anti-inflammatory, a pain reliever. You can give it along with NSAIDs. You can give it for IBD, and you can give it also for arthritis. And remember, I told you that we didn't have any pharmaceuticals that would reduce 5-LOX activity, but we have an herbal, and it's boswellia. So our boswellia is going to decrease this nasty 5-LOX. And look at all the things that the 5-LOX is going to do: IBS, IBD, arthritis, heart disease, cancer formation. So when we activate that system, then we get inflammatory disease, and boswellia reduces that system. So what is it really? Well, it's Indian frankincense, and it's been used for a number of years in Ayurvedic medicine. And I put the dose down there for you because people are always asking me the dose. Although I have to say, I tend to just use it in a combination supplement when I'm using it. But they have isolated at least 4 compounds from the boswellia, and they have anti-LOX activity. And for those of you who like to know about these studies, and as I said, this is how we know, there is one study in dogs that showed 71% efficacy, which is pretty good. And there are a couple of placebo-controlled clinical trials in humans that suggest efficacy for joint pain. So it looks like this stuff does work. But this was an interesting paper that one of our sports medicine and rehab residents wrote, and it was on boswellia and wondering what was actually in these formulations. And if you want to know which formulations she tested, then you can look up. This is from the Vet Anesthesia and Analgesia in 2019, and Aaron Miscioccia did this. And so we have a human formulas and we have canine formulas. The canine formulas are a C and the human formulas are the H. But if you look at some of these numbers, You know, it tells you what is the percentage of things that are on the label claim. Well, some of these were like 180% more than they claim to be. That's kind of a bit of a problem, I think, for some of these things. So I think we need to pay attention to the products that we're using. Now, boswellia is often added to supplements. So it's going to be added to things like we find it in Movaflex. We find it now in Flexidin Advanced, and we find it in Dasequin. So Movaflex is one thing that people do ask me about. What's in it? What does it do? Does it work? So boswellia, eggshell membrane, astaxanthin. We've already talked about HA. And vitamin D, there's been a study that shows if you're low in vitamin D as a human, then you could possibly have an issue with arthritis or inflammatory disease. So that's one of the reasons that it was added. Astaxanthin is an antioxidant, and there is some research in people and a little bit in dogs. Arlie Rennell, who's up in Alaska, he was a huge fan of astaxanthin and wrote a number of papers that went through peer review when I was a resident. And it was very interesting as to what they were doing with this as an antioxidant. Now, as an antioxidant for joint disease, and also as an antioxidant for other things. An eggshell membrane might not be something you may be familiar with, so we'll talk a little bit about that. So what exactly is it? Well, it's got collagen and elastin in it. It's got gags, and they take the eggshell membrane. Can you imagine harvesting those things? I think that'd be hard. Anyway, grind them to a fine powder, and that's how they get the complex. So they've shown that in vitro, it does have antioxidant properties. And the in vivo studies showed improved range of motion, mobility, flexibility, and it does suppress tumor necrosis factor alpha, because someone, Duncan LaSalle's, was in on that paper, and they were very nice enough to look at the biological markers of arthritis and inflammation. And that's in this random control trial of 27 dogs. The interesting thing is it did help with the inflammatory markers, but the CBIPI, the Canine Brief Pain Index, when they looked at that, that didn't show any difference. But there was a client observed mobility index, and the clients thought that the dogs were doing way better. So sometimes the CBIPI might not be very good. They didn't use any force plate with this, but most of these trials these days, they tend to be using the CBIPI, and they tend to be using client observations rather than anything else. But it did decrease the inflammatory markers, so there may be indeed some use for this. Now, this particular product does have HA in it, and I'm just not 100% convinced that the HA is very much a player in here, but I'm sure that the astaxanthin is, I'm sure that the eggshell membrane is probably helpful, and I know the boswellia is going to be helpful. So at least it has some things in there, and I'm still to be convinced yet about the HA. How about turmeric? This is something that people are very excited about these days. It seems that this is in everything. Your clients are probably making up this stuff called golden paste that they have a recipe from the internet for, that they just make out of the regular spice, right? So turmeric and curcumin. So the Latin name is actually Curcuma longa, Curcuma domestica. So our turmeric spice contains curcumin. That's the active ingredient, and turmeric is the name for the spice. So that's where you get that, and it's used a lot in Indian cooking. So for people who are very much a proponent of using this, I really think that as a whole, that people who eat a lot of Indian food should have less arthritis. And I don't know that that's actually the case. But anyway, the curcumin is supposed to reduce pain and inflammation and stiffness and stuff that's related to rheumatoid arthritis and also regular osteoarthritis. It's supposed to help treat bursitis, and it's used as a digestive aid. This kind of sounds too good to be true. So let's talk about this a little bit. Why is this too good to be true? Well, the problem is that that curcumin is, obviously it does this. And if you look at the in vitro studies, the ones they do on the plates, the petri dishes, what you'll see is it does actually do what it's supposed to. But unfortunately, curcumin is not very bioavailable. It's about 0.5% bioavailable as it is. If you give it with black pepper, it's 1%. There are a few veterinary products out there that say they are 5 times more bioavailable. Well, the last time that I looked, 0.5 times 5 is 2.5%. Not very bioavailable. So I think you need to use either an extract like this particular one they talk about. You might use that one. This again is, does it work? Does it not? There was a force plate study. Theracumin or Thorn has a product. These are human products. If I have a client who wants to use this, I recommend those because they have an extract in those, their capsules. They have an extract in there, and the extract is about 13% bioavailable. Now, I know RX Vitamins has come out with a curcumin, I think they call it. Not sure that it's available in Canada. I know it's available in the US, and it's supposed to be a lot more bioavailable. But since we don't have that, I haven't really looked at it. But I would be using either Theracumin or Thorn's product. I think your clients might have to order these online if they really want to. So is it going to hurt if they give their animals turmeric? No, it's not going to hurt them. But are they doing anything? Probably not. That golden paste is just turmeric and coconut oil. So who knows? I don't really know. Devil's Claw. I wonder how many of you have used Devil's Claw. Devil's Claw or Harpagophytum procumbens. That's always fun to say. So it comes from this desert plant in South Africa. And it's named for the little claw hooks that cover the fruit. So you can see the fruit in those and the little hooky things that are on it. And it has been used to treat pain and indigestion, and sometimes as an appetite stimulant, and it's often found in combination formulations. You can get it if you have an herbalist that you work with. You can get it in a straight form. And honestly, I don't know the dose in a straight form. I would look it up in Susan Wynn's book if I wanted to know what it was. I do know that a contraindication for it is going to be gastric ulcers. And I also know, and that the regular Flexidin, it's found in that particular product, not the advanced. It's found in their regular product. It's found in some other combination joint products as well. This particular herbal, this is really a Chinese one, Corydalis Yanhusu, and it is part of a lot of Chinese pain formulas. It is thought to have a mild sedating effect, and there are folk remedies that use it. This became very, very popular recently. Oprah had someone on her show, and they were using this particular Yanhusu for arthritis, and so suddenly everybody wanted to use this. It became a cool and sexy herb to use. It does have THP in it, tetrahydropalmitine, and that can have analgesia and sedative effects. I do know that we do have some new derm supplements out now that have THP in them. We don't have anything that actually has the straight Corydalis in our regular veterinary supplements, but you can use a straight Chinese Corydalis, and I do have some herbalist friends who have used this a lot for dogs who have cruciate ruptures, and have a friend who's out in Nova Scotia who actually presented a paper at the World Association of TCVM a few years ago about 17 patients that she treated with acupuncture and Corydalis that all had cruciate ruptures, and she had very good results with it. So as you can see, it strengthens the analgesia that you get with electroacupuncture, and it is found in a lot of combination pain formulas, and that tends to be what I will you reach for, is the combination ones, and it can be quite effective for chronic and acute inflammation. Good for cancer patients, anxiety, epilepsy. There's a lot of different things that you can use that for, but if you're going to use that and you want to know doses of it straight, just contact me, because there's too much to go into in this presentation about all the different things you need to be concerned about with things like this. So here's one that I put in as a nod to my mentor, Joe Wachschlag, because this is something that is up and coming and people are very interested in this, and you can get these extracts for human osteoarthritis, and also has some sort of utility perhaps in cognitive dysfunction and maybe diabetes. And you've probably seen it as pycnogenol. There's no canine studies on this. And really, so when we were talking about how you would dose it, we were looking at using the human doses and scaling it back. This is also supposed to have a LOX affinity. It's supposed to be anti-COX and anti-LOX. So I suspect there will be more research done on this, but you might see this. And again, if you're super interested in this, just send me an email and I'll give you the information Joe gave me. Here's another one, again, from the Wachschlag, purple passion fruit peel. Kind of an interesting thing. Don't think you can get into too much trouble with this one, but it's rich in polyphenols, and the extracts are supposed to help with hypertension and supposed to help with asthma and bronchoconstriction. There's no canine studies. Would love to know if there's ever going to be feline studies. When I look at the active ingredients in there, any of you who do any holistic or herbal medicine at all, you'll see that their number 6 there is quercetin. And a lot of times people are, and number 10 is also quercetin. A lot of times people are using quercetin in anti-inflammatory formulations for their pets. They're trying to get an herbal cortisone, which there isn't, but they do reach for quercetin. And I can tell you, I've tried it. I don't know. I don't think it works very well, but I have some clients who swear by it and would rather have quercetin than they would have Apoquel, or than they would have prednisone, or something like external wind, which is a Chinese herbal formula for itching. And so, you know, to each his own. But if they ask you about purple passion fruit peel, well, it might be helpful. So here is my friend, Sheila Robertson. Sheila Robertson is an anesthesiologist, and she now works for Lap of Love in Florida. Is a good friend of mine. We've co-taught together. But here she is in a cannabis store in Holland. Now, we don't have to go all the way to Holland to find those. We have them. I have one in Essex. Maybe there's 2, but I know there's at least 1. And they're everywhere, as you know now, in Ontario. So what's the history of using cannabis? Well, cannabis has had a lot of history. This is just actually about the researcher who determined the structure of THC and later CBD, and he called cannabis sativa a pharmacological treasure trove. So I think that's kind of interesting. Here's what the fiber part of the cannabis sativa looks like. And we need to remember that our ancestors back in the 1700s planted this stuff for rope. And really what happened was at the time of the American independence, if you had an acre of land or more, you were required to plant a certain amount of cannabis for the government, because they were using the stalks for rope and the seeds for feed and hemp oil, and they needed fiber and all of these other kinds of things. And obviously the roots and leaves and flowers were used for medicinal use. So I find it very interesting that our friends to the south at one time were required to grow cannabis, and now it's frowned on. I guess they are allowed to grow it again, but anyway, kind of an interesting thing. So what is actually in the cannabis sativa? So there's 421 different compounds, phytocannabinoids of medical interest. There's CBD and there's THC. There's actually more than that. We'll talk quickly about a few other little ones there. But that shows you the different structures for those of you who like to know what the difference is. And the CH3 group is really one of the major differences. So how about other things? Well, there's terpenes, terpenoids, and flavonoids. So these things, the terpenes, these are the things that give the ganja the particular smell when you burn it, the skunky smell. But what we need to remember is that cannabis sativa exists as hemp or as marijuana, and it's really the same plant. If you've bred it and you are Jimmy Buffett, or one of those guys who has their own breed of marijuana, you probably bred it for higher levels of THC. Whereas if you're really interested in the medicinal part, you've maybe bred your marijuana for for CBD, as opposed to Jimmy and Willie Nelson's breeds that are definitely for recreation. So the difference between these plants, hemp and marijuana, is really just similar to breeds of dogs. They're both the same thing. It's just different phytoconstituents. So why is this important? Well, our endocannabinoid system, when I was in vet school, I learned nothing about the endocannabinoid system or cannabinoid receptors. But what I can tell you that I've learned now is that the ECS is found in all vertebrates, and it's part of the cellular communication network, and it's responsible for homeostasis. So it's the thing that does pain, emotional memory, hunger, feeding. It keeps all of that stuff in balance, our own endocannabinoid system. And there's three components, just like many other of our systems. You have cannabinoid receptors that are on the surface of cells. You have endocannabinoids that are the small molecules that are going to activate the receptors. And then you have the enzymes that break them down after they're used. So our two main receptors are CB1 and CB2. And the 1 is most abundant in the brain, and 2 is most abundant in the organs. And here's an interesting thing. Endogenous agonists for the cannabinoid receptors are cousineoids, green lip mussel, antinol, fish oil, krill oil, those sorts of things. But this shows you where the CB1 and the CB2 receptors are. The interesting thing is that the canine has more CB1 receptors than any species on the planet. Hence, they are very susceptible to cannabinoids. So they're manufactured from the cell membrane. They're not stored. And they get released when calcium levels are increased. They have an antioxidant activity, our endocannabinoids, and they function as neuroprotectants. So of our endocannabinoids, there's two major ones, anandamide and 2-AG. So the modulation of this system might result in a cure for chronic inflammatory conditions such as diabetes. So this is why people are so excited about CBD and using CBD for different things. Another interesting thing about our endocannabinoid system is that it has retrograde signaling. Now, what I mean by that is, let me take my pen. So neurotransmitters go from presynapse, they cross the membrane here. This has stuff that goes the other way. You see, it goes like this way. It's opposite the normal neuronal pathway. So kind of an interesting thing. So it means that the endocannabinoids are released from the postsynaptic membrane, and then they bind the CB1 receptors in the presynaptic membrane. So what that means is that stops the presynaptic membrane from releasing other neurotransmitters, particularly in the cerebellum. And as I said, CB1 receptors in the cerebellum, dogs have more than any other species. And if you block all these neurotransmitters, you're going to get static ataxia, and mostly the result of THC. And those who work in emergency probably know about THC overdose. So our CB1 receptor is found in its highest concentrations on neurons that release GABA, which is the main inhibitory neurotransmitter. And the endogenous agonist for the cannabinoid receptor is a cosaderm, or cosanoids, a cosaderm. They would like that, cosanoids. So remember that these receptors are found in the immune system, and they do uprate early phase inflammation. So how about clinical applications? Enough about pharmacology, Jan, and what works with this. What about clinical applications? Well, this is what people are so excited about with CBD. They're using it for pain and epilepsy. It's an anti-anxiety and neuroprotection. So they're trying to use it for all of these different things. And of course, people will say there's no research on using it in dogs and blah, blah, blah. Well, actually, there is. This was a great study that was published by my friends at Cornell. Lori Jo Gamble was one of Chris Fry and Joe Wachschlag's residents. And they put together this lovely safety and efficacy study, and they used a product called Elvet. And this is what they did. They all the dogs were randomized into treatment. They had 4 weeks where they treated 2 mg per kg twice a day, or they got placebo and they did a 2-week washout and they did a crossover. And so what did they do? Well, they did as many things as they could because it's a safety and efficacy study. So they did all the blood work. They did the ending serum concentration, right? They wanted to figure out exactly what the dose would be. So they did that stuff. They did the CBIPI, they did the Hudson pain scores, they did vet assessments, and they ran these things across a tech scan. And what did they find? They found that it actually worked. And in some cases, and of course they did their stats, but in some cases, some of these old dogs were like puppies again. And in some dogs, it didn't work very well. But for the most part, they found that it did work. So there you go. There's definitely that study, and there's a few more now on how well does CBD work. And I do get a lot of people who ask me, can I put my old dog on CBD? Well, in general, you can, but I find it to be very expensive. And what they really found with that study was that CBD works better as an adjunct. So great in those dogs that have chronic pain and cancer, something else that you can add. But if you're going to do that, you need something that's got a little bit of THC in it, right? So here's a few other molecules of interest. CBD, we know we're looking at potentially therapeutic inflammation, neuroprotection, and neuropathic pain. But there's a CBDA, which is maybe even better. And then you have the regular THC, and then you have the 11-OH THC, which is those ones in the red we probably don't want too much of. But the THCA might be neuroprotective. And these other couple metabolites are very good in people. So just looking at straight CBD, those CBD isolates that are straight CBD, not a full spectrum, we might be missing out on some things. So here we have, what are we going to look at? Dispelling or confirming myths and fake news. So these are questions that people often ask me. CBD dosing for dogs is unknown. Well, no, not really. 1 to 2 mg per kg Q12 hours in most of the studies. And there's not just Lori Jo's study, there's a couple more out of Colorado State and a few elsewhere. CBD is the most important cannabinoid for pain relief? No, actually, they think maybe now that CBDA might be better. THC is toxic, shouldn't be in the mix. Well, maybe THCA isn't a bad thing for some things. And CBD and cannabinoids are metabolized differently. Well, they really aren't. It's only the form that's important. And usually, if you're giving it to a dog, it's better if you're giving it with food rather than in a fasting form. So that pretty much concludes our information on
So this
CBD.
is the end of our presentation for today. I want to thank Dr. Joe Wachschlag for the use of some of his slides.